everyone, welcome back. Maintaining strong and healthy bones is essential for our overall well-being, especially as we age. While a balanced diet full of bone-supporting nutrients and regular exercise are important, certain supplements can also provide additional support for bone health. So in today's video, I'll be discussing why is it important to support our bone health, what are the best supplements for bone health, what nutrients contribute to bone health, and lastly, what are some additional strategies to help promote bone health. Hi, I'm Katie Bailey. I'm a registered dietitian at Fluso Nutrients, where we provide supplement education and professional quality supplement options for you to make the world of nutrition supplements a little bit easier to navigate. As always, be sure to check with your main nutrition literate healthcare provider before starting anything new, as we can't know your full medical history to provide a personalized recommendation. So without further ado, let's jump into today's topic. Why is supporting bone health important? So bone health is crucial for mobility, strength, and protection against fractures. And as we age, bone density naturally starts to decline, increasing your risk for osteoporosis and fractures. Factors such as a poor diet, lack of physical activity, hormonal changes, as well as nutrient deficiencies can all contribute to weakened bones. Fortunately, there are several different ways in which to promote our bone health and decrease the risk of bone-related health conditions. What are the best supplements for bone health? So the first one I want to talk about is called ProBono, and it is from Orthomolecular Products. This is a bone-building supplement that's designed to increase our skeletal strength, enhance bone remodeling, and maintain healthy bone density. It includes therapeutic dosages of specific nutrients such as strontium, which is a mineral that strengthens the bone matrix and maintains a healthy bone density by promoting bone formation rather than bone breakdown. It also has calcium and magnesium, which are essential for bone formation and strength. It also has vitamin D3 and K2, which is essential for calcium absorption and bone mineralization. And then lastly, boron, as well as a few other essential vitamins and minerals to support overall bone health. This is an all-in-one approach that eliminates the need for multiple bone health supplements, and it's a convenient choice for those seeking to promote bone health. The protocol separates calcium and strontium in order to maximize absorption, ensuring that the minerals are going to be effectively utilized by the body. So ProBono's AM and PM packets provide a structured, easy-to-follow regimen. The protocol includes taking the AM and PM packets daily, and then for maintenance, taking one packet a day and just alternating between the AM and the PM packets. The next supplement I want to talk about is boron. So boron is a trace mineral that plays a crucial role in bone health. It improves the absorption of magnesium, and about 60% of the magnesium in the body is found in the bones, and it acts as a cofactor for the enzymes that regulate calcium metabolism. Boron facilitates magnesium deposition in the bone, increasing bone's strength and density. Boron has also been shown to help with vitamin D absorption, particularly in those that are deficient. And we know that vitamin D is essential for calcium absorption as well as bone health. Boron also reduces bone loss and supports remodeling due to its role in bone formation. And studies have shown that boron supplementation can increase bone mass, volume, and thickness while decreasing calcium excretion. It also helps to direct calcium into the bones and the cartilage, preventing joint deterioration and supporting bone mineralization. And in general, the recommended dose of boron to support bone health per day is 3 to 6 milligrams. The last supplement I want to talk about is calcium. So calcium is the most abundant mineral found in the body, and it's primarily found in the bones. You can get calcium from dairy products, leafy greens, salmon, almonds, and many different fortified foods. It's the primary building block for the bones in the teeth, and it's essential for maintaining bone structure and strength. Without enough calcium, bones start to become weak and brittle and can lead to conditions like osteoporosis. Calcium citrate is often the one that's recommended, as it's better absorbed than calcium carbonate and can be taken with or without food. It's also important to look for a calcium supplement that also includes vitamin D3 and K2, as this helps with calcium absorption, as well as helps to direct calcium to the bones and the teeth rather than the tissues. and the recommended daily intake of calcium should be between 1,000 and 1,200 milligrams. It's important to check with your healthcare provider before starting any new supplements, especially if you have any pre-existing conditions or are currently taking other medications. Now let's talk a little bit about what nutrients contribute to bone health. So bone health is supported by a variety of different nutrients that work synergistically to maintain bone density, strength, and overall skeletal integrity. Now we already talked about boron and calcium, but there are a few other ones we're going to discuss. The first is vitamin D. So we know that vitamin D enhances calcium absorption and bone mineralization. Magnesium is vital for bone flexibility and density. It activates vitamin D and it regulates calcium metabolism. Vitamin K2 helps to direct calcium to the bones and teeth and away from the soft tissues. It also activates a protein called osteocalcin, which is essential for bone mineralization. Next is phosphorus. Phosphorus works with calcium to form the mineral component of the bones. And then lastly, zinc and copper. Zinc and copper are trace minerals that are cofactors for enzymes that are needed or included in bone formation. What additional strategies promote bone health? The first is to support our gut health. So optimizing digestion and supporting our gut microbiome is going to help to improve nutrient absorption and decrease inflammation, which are both going to indirectly support our bone health. We know that exercise is crucial for helping to support and maintain bone density and our muscle mass, particularly weight-bearing exercises, walking, jogging, dancing. This is going to apply mechanical stress to the bones, which is going to help with bone formation, while resistance training is going to build muscle mass and improve our bone strength. Stress management is essential, so mindfulness, meditation, deep breathing. These are all important to practice as high cortisol levels will accelerate bone loss. And lastly, avoiding smoking and alcohol, as both of these can negatively impact our bone density and increase the risk of fractures. To wrap up our topic for today, ProBono, boron, and calcium supplements are all great options for supporting our bone health. It's important to remember, though, that although these supplements can be beneficial, they should be combined with a balanced diet that's high in bone-supporting nutrients, regular physical activity, and a healthy lifestyle. If you're interested in trying any of the supplements I discussed today, I'll have them linked below in the description box. That's it for today's video. If you like this video, please hit the like button and subscribe for more nutrition videos. Let us know in the comments if you have any questions, and if you'd like to work with our clinic, you can click link below to schedule an initial appointment. We do take insurance. You can find more information about that on our website. Thank you for watching. I'll see you next time. Bye.